Okay, this video is, does fatty liver cause kidney stones? And the answer is yes, of course. The things that cause fatty liver are associated with kidney stones. But there's some interesting things about this. We'll talk about them here. Here's an ultrasound. This is the most common way on imaging fatty livers diagnosed. The kidney parenchyma, which is mostly filled with water, the renal cortex. Cortex means bark, like the bark of the tree, so it's the outer periphery of the kidney, is compared to the liver. Fat is less dense than water. So from the sound point of view, well, let's just say from the sound point of view, we're talking about ultrasound here, the liver is more hyperechoic. It's more brighter. This is darker. The kidney's darker. So anyways, this is standard. I see this 20 times a day sometimes. Okay, I see fatty liver all day long. And the other reason why it got my attention was, I've been reading a little bit and thinking about kidney stones a little bit lately. And when I look at follow-up ultrasounds of patients for kidney stones, nephrolithiasis, usually abbreviated NL, almost always the patient has a fatty liver. And that's what's funny about it. Fatty liver has become so common that it's considered normal aging. If a patient, let's say, has a major problem, let's say an acute pulmonary embolism, I pick up the phone and I call the doc and let them know. But if I see fatty liver, I don't tell anybody. I just consider that expected. The majority of the patients have fatty liver. Okay, if you were calling people or sending them, email alerts or something about every time there was a fatty liver, they would have 100 of them a day. I mean, there'd be so many of them. All the patients have fatty liver. Fatty liver is associated with a diet high in animal protein, high in fat, high in sodium, high rates of obesity, high in fructose. Well, guess what? Kidney stones are associated with all of those things too. So they're almost like going together. I'm going to show you a couple interesting things here. I had a little bit of fun putting this talk together. Here is how we diagnose fatty liver on a CAT scan. This is the liver. Where it says V, that's for the vessels. The liver right here is very low in density. CAT scan is all based on density. HUs are Hounsfield units. Hounsfield is one of the co-discoverers of CAT scan, so those are units of density. So there's less density units in the liver than there is in the spleen. So normally the liver should be more dense than the spleen. Okay, spleen is kind of like a bag of blood. Okay, so anyways, this is a hypodense liver consistent with fatty liver. Now, what are the causes? We talked about, excess dietary fat, high fructose corn syrup especially. Some claim even excessive amounts of fruits. I realize that's sort of a hot button topic, and I'm not going to go into much detail, but I will say a few other things about it you're going to find interesting. I got some good paper. I got a good paper on fruits that's going to get a lot of the fruit promoters kind of feisty. And don't get me wrong, I eat a lot of fruit myself, but there are issues with it. Glyphosate causes fatty liver. Senef is the big researcher on that. When somebody's got fatty liver, they've typically got metabolic syndrome, which means insulin resistance, prediabetes or diabetes. I think of fatty livers as basically diabetes of the liver. They're also at increased risk for coronary artery disease and early death. It means the patient typically is screwing up with their diet. NAFL is non-alcoholic fatty liver, leads to NASH, non-alcoholic steatohepatitis, and that leads to cirrhosis potentially, and potentially need for transplant or even liver cancer or death. So I'll show you what that all looks like in a moment. I got pictures of all this stuff. Here's fructose. Glucose, for example, goes right from the gut to the blood, goes all over the body. It's the favorite food of the brain and many other tissues like the spine, the discs, and whatnot. But fructose is different. Fructose goes almost entirely to the liver. And unlike glucose, some glucose goes to the liver. Glucose, when it goes to the liver, it's very, 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 very carefully regulated. Fructose is not. Fructose hits the liver as a bolus, and it enters glycolysis at the 3-carbon phase, meaning that it bypasses all the regulatory steps. So glucose is regulated tightly by the PFK, phosphofructokinase enzyme, meaning that you are not going to burn glucose in that liver unless you have a very good reason. The liver would rather store it as glycogen, which it can use later to maintain blood glucose during fasting, okay? Because the job of the liver, the most important thing the liver does, is maintain the blood glucose level during fasting so the brain always gets enough glucose. Okay, but fructose is like considered a present, okay? Fructose comes in and it's like, what the heck is all this stuff for? And they very quickly will often make it into fat, and it'll generate uric acid, and when the uric acid is generated in high amounts, that'll elevate the blood uric acid and increase the risk of gout. That also causes insulin resistance. It causes blood sludge. It's a bridging molecule to stick red blood cells together. Okay, but what you need to know is fructose goes to the liver, and it is potentially largely made into fat, causing fatty liver. Okay, especially when you have a bolus of it in like a processed food with high fructose corn syrup. Here's some interesting papers though. Fructose promotes fatty liver. 25% of fructose with increased risk of fatty liver. Okay, a high fructose diet was associated with more DNL, de novo lipogenesis. So even a short-term high fructose intake was associated with causing fatty liver. This is patients fed a 25% fructose diet. Okay, here is servings of fruits. Now this gets interesting, and this is something McDougall talked about. McDougall had recommended only 2 servings of fruit per day. And you look at this randomized control study, they claimed that when patients ate 4 servings of fruit per day or more, they had increased insulin resistance, increased diabetes, increased liver function tests, an indicator of fatty liver. They also had an increased LDL cholesterol, and they had elevated blood glucose. And it was a randomized controlled trial in comparison with patients who had 2 servings per day of fruits. I tried to read the actual paper, but it was not available. All I could get was the abstract, but I did find that a little bit interesting. And it did support the things that McDougall says. He's not that big a fan of fruits. I actually like fruits, and I eat about 35 to 40% of my calories from fruits. But I'm young. I'm 60, almost going on 61, but I exercise a lot. Young people who exercise a lot can eat tons of fruits. And I do think, we got color vision to see when fruits are ripe, and it's a very natural thing. We salivate immediately when we see it. Okay, anyways, getting back to the fatty liver and kidney stones, which was the original reason for making this talk. Here is a coronal CAT scan with the patient facing towards you. You can see there's a fatty liver because the liver is less dense than the spleen. So we know we got a fatty liver. Here's a normal looking kidney. It's opacified, dense because it's taken up IV contrast, iodinated contrast. This is the renal cortex, like bark of a tree, the periphery of the kidney. These are the renal medulla, the more central part of the kidney that does the filtration work. In here is where the urine is collected, the urinary collecting system. And the contrast has not yet reached the collecting system. This is sort of the early phase. This is the nephrogram phase, meaning opacification of the parenchyma with not yet opacification of the collecting system. Okay, well here's where it gets interesting. This is a stone. This is a kidney stone, and it's blocking the renal pelvis. So these are the calyces up here, and they come into the renal pelvis, and then the ureter is a tube that connects the kidney down to the urinary bladder down here. But there's a big stone, that looks to me like about 1.5 centimeters in diameter, blocking the renal pelvis, causing swelling of the calyces. When the calyces are swollen, that's called hydro or hydronephrosis. And so this is an obstruction. This stone is obstructing the outflow of urine from this kidney to the ureter, and that's a dangerous situation. With complete obstruction, you get stasis, and you can potentially get a bacterial infection. You can see there's another little stone here in the lower pole of the left kidney, and probably these were previously a big stone, and this broke off and moved into the renal pelvis and obstructed it. But this is sort of a classic thing. And by the way, I see this sort of thing all the time. Fatty liver with kidney stones. They go together. When I see a follow-up for kidney stones, I just assume there's going to be fatty liver. It's part of my macro when I dictate a case. Whenever the kidney stones, there's a fatty liver. I mean, it's rare that that's not the case. Okay, we talked about how fatty liver is basically diabetes of the liver. Okay, and that this is the fat stages of diabetes, and it's related to the Gerald Shulman ectopic fat theory of diabetes. And so I made up my own staging system for diabetes based on the location of the fat. It starts out accumulating in the skeletal muscle. That's also called intramyocellular lipid. Okay, then it accumulates in the liver, fatty liver, which is prediabetes, diabetes of the liver. Then it accumulates in the pancreas and contributes to destroying the beta cells, the beta islet cells that make the insulin. Okay, then the patient gets all the secondary complications after that. So the point is, you want to minimize your dietary fat intake and control your body weight ASAP, so you don't progress to these later stages where you start destroying your eyes, your Johnson, your kidneys, your heart, and your peripheral vasculature to your feet and to your brain. Okay, here's a typical progression. You have a normal liver over here, and then you accumulate fat in the liver, and they call it a NAFL, non-alcohol fatty liver. That's because you also get a lot of fatty liver from alcoholism. But, most patients, most commonly, there's a lot more people who eat a high-fat diet than there are alcoholics. So we see tons more NAFL, than we do, alcoholic ASH, alcoholic steatohepatitis. Okay, so anyways, NAFL becomes non-alcoholic steatohepatitis. The itis means it's inflamed. Inflammation progresses to fibrosis, scarring, laying down a collagen. That leads to contortion of the liver, so it'll have a nodular contour, and that's called cirrhosis. All that scarring in the liver leads to some tissue being isolated from good blood supply, and it'll become hypoxic. Hypoxia then creates a mechanism of the Warburg effect, whereby the mitochondria don't get enough oxygen. They can't make adequate amounts of ATP, so the cell reverts to anaerobic metabolism. That is called the Warburg effect, from the work of Otto Warburg, who won the Nobel Prize in 1931 and showed in tissue culture that normal cells will transform into cancer cells when they're subjected to hypoxia. Okay, and there's liver cancer; it'll kill the patient. Okay, and these patients, just from the cirrhosis, will sometimes need to go on to liver transplant. So here is the flavor enhancer, monosodium glutamate. It could also nowadays more commonly be MFG, manufactured free glutamate. And they find that that when the patients eat more of this, they have a tendency to become obese and to have more fatty liver, which I found a little funny, because you'll see people on the internet, including some of the high-fat phonies, saying that MSG is okay. No, MSG is bad, and it's actually pretty well known. And it's not even MSG anymore. It's MFG, manufactured free glutamate. Because it's just cheaper and easier to make that, and that's more common. And that's easier to hide in the food. Okay, here is an example from the work of Roy Taylor. He's the endocrinologist doctor who was very good at curing diabetes. He says you start out with a baseline fatty liver. Okay, this liver is 36% fat. It was measured in one of his studies. And if you can get the patients to lose 30 pounds of weight or more, all of the patients who had type 2 diabetes of 4 years duration or less, they were cured, just cured of type 2 diabetes. So that's why I always think all these patients who say, I'm taking my pills, my type 2 diabetes is under control, they're stupid idiots. They could cure themselves. Why take a pill every day when you could cure yourself? And the pill is not going to cure you. You're going to progressively get worse and end up on insulin-dependent diabetes. So this is an MRI technique to measure fatty liver. So this was the baseline 36% fat. And this was after the patient lost weight, and the liver, the fat first comes out of the liver. That's the most metabolically active fat in the body before they lose it around the body. You can see the red stuff here, their subcutaneous fat is really not much different, okay, but their liver is totally depleted of fat, okay. Here's like a scale for fat, okay, 100% fat's all this red stuff. So sub-Q fat really didn't change too much, and the scale of the images isn't exactly right. This one's could be a little bigger. So basically, sub-Q fat, not much change. Liver fat, totally depleted with 30 pounds of weight loss. Okay, and then here was his diabetics. They're fasting blood glucose. It started up here, but once they lost weight, it went to next to nothing, and it happened really rapidly. Notice that their blood sugars came back down to normal in less than 2 weeks, really in barely over 1 week. They were in great shape. So these are type 2 diabetics of 0 to 4 years duration. They were all able to cure themselves of type 2 diabetes, just like Kempner used to cure all his type 2 diabetics. And McDougall will tell you, all type 2 diabetics can be cured, if you get to them before they've trashed their beta islet cells that make the insulin. Here's just a couple papers, a little bit interesting. Association of non-alcoholic fatty liver disease, NAFL, they threw the D on there for disease, with urolithiasis, a fancy way to say kidney stones. So NAFL is associated with increased kidney stones. It's obvious, everybody knows that, but I just showed you a paper. Some people like to see a paper. Okay, and here's another relevant paper. Association between NAFL, non-alcoholic fatty liver, and subclinical coronary artery atherosclerosis. Yeah, of course. When you see fatty liver, there's an increased likelihood the patient has coronary artery disease, atherosclerosis in the arteries of the heart. And it's obvious because what causes NAFL? High-fat diets, animal food diets, insulin resistance, diabetes. Well, those are all risk factors for coronary artery disease. And this also gets back to a lecture I gave recently. I gave like a 5-part lecture on is it all the same disease? What I'm trying to tell you is all this stuff goes together. The Western diet is animal foods and processed foods. And that leads to a lack of dietary fiber, so they get abdominal pressure syndrome. That leads to the high fat being a bridging molecule, causing hypertension, causing atherosclerosis. The flavorants like MSG, MFG, and all that, and the sodium, that gets people to eat more of it. Dietary sodium is also a risk for stone formation. So anyways, all this stuff goes together. And it's actually good news, because what it means is you just don't eat this stuff, and you make a dramatic improvement in your health. And it also shows you how paleo, keto, carnivore, low carb is all a bunch of nonsense, because meat and high-fat foods and processed food, they're not bad in one way. They're bad like in about 50 ways. You can't polish a turd, okay? That's just for chumps and losers. Okay, anyways, hope that was helpful.